Okay, WHO, so we attended a meeting of CETA in 2016 in December. That meeting was about expanding access to safe abortion. One of the key work streams that emerged was technology issues, and especially the issue of making medical abortion, quality-approved medical abortion drugs more accessible and available. So out of that meeting, we all started scratching our heads a bit, and WHO called a second meeting focused on expanding access to medical mifepristone, misoprostol, and Combi-Pax. Combi-Pax being the co-packaged package that has both the mifepristone and the misoprostol for induced abortion. We've been working with Concept Foundation. Hans can speak a little bit more to what they're actually doing to try to figure out how to select countries to work on to expand access. And I got to thinking today, rather than me make a presentation, maybe I should ask all of you some questions, because we have some hard questions to answer. Basically, at the end of the day, we want women to have access to medical abortion and to low-cost, quality-approved products. That's the goal of all this. To do that, we have to get quality-approved products registered. They have to be purchased by someone, either a private distributor or maybe an NGO or maybe the government. And then they have to be distributed to pharmacies or to healthcare institutions, etc. Quite a few medical abortion drugs have been registered in countries, but they're not always available in countries, because registration is just one step. You got to also do procurement. So we're starting to think, well, maybe we shouldn't even think about registration unless it's really tied closely to procurement, because there's no point in registering unless there's money to procure. We're asking ourselves some questions. Why register a quality-approved product? Well, we at WHO think that we need to have products that meet the gold standard for quality. However, there are some products that are just under the gold standard, but maybe they're fine. Maybe they're whoops, hit the wrong button. Maybe they're quality enough. But WHO cannot, and probably the UNFPA also cannot promote something that we can't ensure the quality of. We have to ask ourselves, who will register the product? Is it going to be a distributor? Is it going to be the government? An NGO? Rodica has experience that she can recount about registering Medibon. There's lots of different ways to do it. Who's going to pay for it? Each government system's different. Some governments cover the cost of these drugs. Danielle just explained to us that women are reimbursed for the cost of medical abortion in France. New Zealand covers the cost for free for all women who are resident in New Zealand. I think the National Health Service in the UK probably does something similar. These are all big questions. So, another question is, what are the costs, and how do you keep the cost low? So we know, for example, Medibon being an example, if you order a minimum of 25,000 packets of Medibon, you can get that drug from the pharmaceutical company for $3.75 per packet. How many countries here have 25,000 or more abortions per year, medical abortions per year? France, okay. U.S. Ukraine. Yep, Ukraine. Maybe Uzbekistan, maybe, yeah. Uzbekistan, do you have Romania? More than, yeah. Yeah. Okay, so a question is, now, in all of these countries, how many medical abortion products are already registered? How many quality approved products are registered? The U.S. has a quality approved product. France has a quality approved product. What are you using in Romania? Medabon. Okay. $49. Okay, so let's talk about that. Somebody bought it for $3.75. The woman and sold it for $49. So what happens in there? So somebody registers it. That has some cost, presumably. Then maybe the same person that registered it procures it. Maybe it's a different place. It costs money to procure it. You've got shipping, you've got taxes, you've got profit. Then the distribution, maybe the distribution is by the same person that registered and procured. Maybe it's different people. In that distribution circle, you also have the healthcare facilities, so the doctor needs some money for the services. Maybe it's reimbursed. If it's reimbursed, as Danielle says that women get reimbursed in France, the government still has to cover the cost of that reimbursement. In Ireland, they're talking about 400 euros to reimburse doctors, so there's a huge range of costs that the healthcare institutions also place on this. So by the time it gets to the woman, the range is huge. Rodica, yes. What's the price when it gets to a woman in Moldova?
In Moldova, it's $11.
$11.
Yeah, it's $11. And this is because we cannot afford 25,000 packages per year. Our highest amount of procurement is 5,000 for almost a year, and it's enough for us. This is why, and it was very difficult to convince them to register it in Moldova because of the small market. It's another issue. So, but we are happy so far with this amount.
Okay, good. So the question of this initiative is how to select countries to work in. Because if a country already has a product registered, is there enough space to encourage another country to come in with a quality approved drug to compete with that drug that's already there? Competition drives the price down, but is there enough market to allow 2 or 3 or 4 companies to be profitable? Because the companies won't be interested unless they can make some profit off of it. So these are all questions, and we're trying to think how to select countries to work in. So we are still trying to figure that one out. I think we've discussed that already. And this is from the UNFPA website as well, and I was going to ask this question of UNFPA. And maybe I'll ask the question now. To UNFPA is, you have in your product catalog a Combipac, that's Medabon as far as we know. And you have the individual mifepristone pills. We understand that UNFPA has negotiated the $3.75 per packet price for the bulk order of 25,000. Can these countries procure Medabon through UNFPA? If they're already procuring contraceptives, can they procure Medabon? And that's one question. And another question, because many of the countries are small markets, Kyrgyzstan, Armenia is probably a small market, Azerbaijan is probably a small market, Turkmenistan is probably a small market. So could UNFPA, if the 4 countries were to put in a joint order, could UNFPA then sell it for $3.75 a packet if that joint order added up to 25,000 or more packets? So we're trying to think of innovative, creative ways to use a wonderful procurement mechanism here, but to keep the price down at the same time. In other regions, there are also lots of small markets, and the issue is just how to pool so that the price can be down. Who's going to pool? UNFPA is not everywhere.